I'm Dr. Bradley Lembcke. I'm an internal medicine doctor by training, and currently I'm serving as the president at Baylor St. Luke's Medical Center. We're a quaternary hospital, so do transplants, advanced cardiac procedures, oncology, etc. We're located in the Texas Medical Center. Baylor St. Luke's Medical Center was founded in 1954, one of the first hospitals in the Texas Medical Center. And, we are the home of the Texas Heart Institute that Denton Cooley formed back again in the 50s and 60s, and did the first heart transplants in the United States, the first artificial heart transplants, and most recently did the latest version of the total artificial heart, the Bivacor, here at our hospital this last year. So we're part of a larger healthcare system called Common Spirit Health. We're the largest not-for-profit health system in the country. About 2,500 doctors on staff, about about 4,000 employees. We are licensed for about 881 beds, but that's back when you would put two people in a room, and so most of the time we don't have to do that. So when we're really busy, we're at about 600 patients over here at the main campus. It really is spectacular, and looking back years, the origination of it was a donation from a donor donated the land, and the stipulation was that it needed to be for healthcare and it was nonprofit. And so we have, again, Baylor St. Luke's Medical Center is one, Herma Memorial Hospital is another, Methodist Hospital. We have, of course, MD Anderson is right next door. We have one of the top rehab hospitals in the country in Tier, located here. We have two medical schools. We have, several nursing schools, several ancillary schools, a ton of research. The economic output of this the Texas Medical Center is larger than many cities across the country. And so, there are a ton of really advanced, innovative areas that each one of us work either collaboratively on, or sometimes it's, one area, has really a focus on something, and we're in a little different area. But in general, you can just about get any care that you need in a advanced, super subspecialist and or cutting edge individual and program in the medical center. Maybe not all of us do every single one of us, but one of us does just about everything. It really is all about advancing the care of medicine for the patient. We 100% are adopters, and the rapidity of it really surrounds the resources that go around it. And I think everywhere across the United States and beyond, healthcare is expensive, even when done well. And so making sure that you're able to really keep your infrastructures up to date and your equipment up to date, and the new innovations really are things that we need to be sure that we're not neglecting and updating. Just one simple example is telehealth. And so that was something that rapidly moved that to the front of the line. And not that people weren't doing it, we weren't doing it with as vigor and as well as we could. And now it's incredibly adopted both in our clinics, but also now in our hospitals. We have telesitters. So when a patient needs a sitter, we have those. We have telenursing that's able to help with hourly rounding, having education, discharge planning, implementing orders, and are rolling that even further out into our emergency department to even work with precepting nurses, because how do you extend your staffing when there's a large deficit in healthcare staff, and we're all competing for the same people. Well, how do we onboard them, support them in a manner? And so adopting technology to be able to do that are things that many people are looking at. We're doing that here across Common Spirit that are becoming ingrained in our day-to-day activities are some of the machine learning AI technology related to throughput and the just coordinating and learning how to optimize your resources to be able to move people through the system as effectively and efficiently as possible and spur those along appropriately, leading to the best outcomes for all. The longer you're in the hospital, the more likelihood you'll have develop a complication. So if we can shave time off and move people through most effectively, then it's a good, quality move. It's a good, financial move. And so those are other technologies that are being implemented and amongst others. For those who are, developers and are interested in bringing new products, we are open to having those conversations and helping us solve our problems. And, oftentimes it's difficult to get in the door. Well, our doors are open. And I think that's really my message is our doors are open. And, this is your solution may not work for everyone. We understand that, but each time we have a meeting with someone, we all take away positive aspects of that. So we are thrilled to have, those individuals come, talk about what they're thinking. We're happy to share where our pain points are. There's a lot of smart people out there that we want to be able to engage with so that they can help us.